As a quick overview, here are some of the situation analyses that folks have been submitting, and most of them we're sending back. I'm going to show you why. So first of all, here you have a project, number 13, so obviously we're not showing the authors here, that is not using the template. So there may be some good situation analysis, but it will be much more helpful if you can put this into the format that has been requested. This is another one, so we do ask that you do not identify yourself. So for Jane, we do ask for your role, position, and so on, but not for your name, so that we can have anonymous peer review. I'm not looking at the substance of these, so, but let's have a look. There's a child who came to our welfare clinic. The child had not received immunization services, and then this is about gender barriers. This could be an interesting situation analysis, but we need more information, the data sources, the references, the next actions. This looks like a case study of gender barriers. Let's go to the next one. All right, this one is actually using the template, so that's a good step. Looks like it's been filled in correctly. Has got a key area of focus, has got a challenge, and then has got a question, but maybe it feels to me like there's an intermediate step between refusing vaccination and knowledge, attitude, and practices, something more specific about knowledge, attitudes, and about COVID-19, for example. Right now, there's no cover notes, so maybe the person just tested to see if they could submit. There are some references, so that's good. When you can do that, you can also rely on your own experience and recognize the limitations of what you know as a result, if it's just from your daily work, but also emphasize that that is what you believe may be the best source of information. So here we see this person seems to have taken notes. Data sources, so literature review. I would not, given the short time frame and given the very practical orientation, remember, this is for your benefit. The next step is to develop your IA 2030 action plan. So data sources that are relevant, don't launch a big literature review or anything like that unless you feel you can do that within the 2-week time frame. The live updates from experts, which I participate in. That's experience. That's a good data source. Key findings. All right. Knowledge deficit on the benefits of immunization. That's an interesting finding. But have you done root cause analysis, which means have you asked why is there a knowledge deficit? Is it lack of pre-service training, lack of in-service training? Is it misinformation? We want to go deeper in order to get to the root cause of the problem. That's the point of situation analysis. Now, the next step is, all right, here the person has mapped out a short virtual course. So that would make sense indeed if there is a knowledge gap. But there could be other things going on. So you'd want to make sure that you've gone all the way down. But this is promising, and it still does not have Ideas Engine references for the next steps. It's really encouraging you to use the Ideas Engine to inspire you to find innovative next steps. Now, the one Geneva saving practices. Okay, this is how immunization is been done within my region. So that's not a challenge unless you tell us what's wrong with how immunization has been done. This person has not selected a key area of focus from Immunization Agenda 2030. What will I be doing when the situation analysis has been approved? So, okay, you want to write out the question you want to answer by analyzing your situation. So this sounds like this person is saying, I'll use the situation analysis. I want to find out what actions I take. You want to put the question at the level of your challenge. So if the challenge here has not been correctly defined, so you say, if you think it's not being done properly, so staff are not skilled enough or not competent or not doing immunization right, then you would want to know, what are the factors contributing to low competency or low performance of immunization staff? That could be an example. All right, this person has written the cover note, more skills to be added to me by my leadership. The leadership should know. So you're actually writing to the leadership, so you can say, dear sir or madam, that's one thing, and you want to only do that once you figured out the rest of it. I've been observant and truly I would want an opportunity given to me how I could chip in my idea. Okay, that's not describing your situation. What is the situation? What's happening with immunization? What's happening with staff competency if that's your focus? Data sources, okay, personally geared by me, so it's legitimate to say I'm relying on my experience, that's my primary data source. But remember, this is public health, which is evidence-based, and at least have one other data source. So even administrative data, just to point out how unreliable it is, and that maybe you trust your experience for, could be one way to do it. Key findings have not been filled in. Next steps. The use of computer gadgets should be improvised to help outsource data. Okay, so obviously this person has not actually done that, and is missing the ideas engine as well. So you can see there's a lot missing in this project. Now this person it looks like, has done a SWOT analysis, so an analysis of strengths, weaknesses, opportunities, and threats. So, yeah. Yeah, that's what we see here. So there is a relationship between SWOT analysis and the situation analysis, trying to get to the root cause of problems, but you simply cannot copy and paste a SWOT analysis that you've done. You would need to find, here we don't know what the challenge is, we don't know how this fits into Immunization Agenda 2030. There's obviously a lot that we are missing. Let's go to the next one. Okay, this one is in French. So obviously this person made a mistake, did not understand that they submitted this in the English. Please, if you are Francophone, there is another group where you should submit if you are Francophone. All right, let's see here. This person has forgotten to put in the right title at the top. So it does look like there is some information here. My challenge, 0 dose. Please be more explicit, be more specific. What is the 0 dose challenge in Tilden Fulani? In Toro local government in Bauchi state? No, we're missing the key area of focus here. How can you immunize 0 dose infants that are more than 2 weeks old? So that feels like it's on the way to being the right question, a question you can answer by analyzing situation. With 0 dose, it's reaching them to immunize them. So maybe that's just a way of saying it, I'm not sure. Now here, don't put your, the yellow box is really just the guidance, so don't put your comments or your writing into the yellow box. Let's see, they shouldn't be missing their immunization. Okay, this does not look like something that could be presented to your boss, or any boss for that matter. My situation, mothers used to come, we tell them they missed it, but we can only give them BCG vaccine. Okay, so now I'm beginning to understand what the situation is. It's there's a constraint. They can only do BCG, but it's obvious that they're missing other vaccines. That could qualify as missed opportunity for vaccination. There's a lot of guidance there, but again, this is a bit short for me to make sense of the situation. I have to kind of guess what is actually going on. Now the data I use, okay, this is specific local data, so that's excellent to see that in this project. Why they are the best one, yeah, what I'm missing is why is this the best one? I can infer that because it's a sort of educated guess or semi-educated guess on my part. And then the key findings, can't give it back, but only... All right. Okay, so I'm not sure what you want in the findings is what did you find from analyzing the situation? What did you learn from analyzing the situation? So it sounds like that initial, here's the situation, is your finding that, that can't be. There are no next steps, so you obviously want to fix that. And then, okay, this is good. There is actually an idea here with the ID number from the ideas engine, but of course, the whole point of citing ideas is to show then that these are used to determine your next steps. But right now, there's no next steps here. So next is thinking outside the box, immunization breakthrough in HTR and security compromise. So try not to spell out the acronyms the first time. This is Southern Zone of Nigeria, primary healthcare practitioner. That's fine. Challenge, inability to conveniently and fully reach out to the eligible target group. We don't know the eligible target group. All right, so here this looks like SP1, but we need to know not the strategic priority, but the actual key area of focus. So the question is, how do I convince key players to think outside the box, but for what? So this sounds more like a analysis, a policy analysis than a situation analysis. These look like, so the cover note is an actual message. Dear supervisor, dear director, Mr. Director, Sir, Madam, here's the situation. Here's what I found. Here are my sources of data. 1 or 2 sentences for each point. Now, my situation, all right, cannot conveniently access these settlements because of the risk. So we're talking about security risk. Security compromised settlements. It was mentioned, but I almost missed it. So if that's the problem, you need to be very, very explicit that is what is going on. Government is not ready to lose any member of the health team. Their hands are tight. Okay, so this one thing I want to acknowledge here is this person obviously has very specific practical experience with this problem. So you should be able to, if you have that, you need to put it on paper in a way that people who are not there with you can understand it. How can these eligible children be vaccinated against vaccine preventable diseases? Okay, and I like this person has said, if I can answer these 2 questions, that's at least half of my solution. All right, and then there is some information about episodes of measles outbreak. Let's see in the data sources. Okay, very good. I keep records and write reports on such occurrences. To me, that's legitimate. Now, it'd be even better to have the actual reports, the actual, cited and so on. But fair enough. If you've been working in this district for 10 years, show us that you know and understand what's going on. It's not only some people have been there for 10 years and maybe haven't been very diligent and don't fully understand the situation. So show us what you know and what you know it. Acknowledge as well what you don't know. Now, the key findings, so data shows a wide gap. Okay, so but which data, which records that you're keeping? It's good to get that specificity, but I could see how if I were doing this for myself, I could use this. But if I'm sharing it with others, asking others for feedback and advice, then I would want to go further. All right, I cannot solve this situation alone. Okay, that's an important recognition, but where does it come from? How did you realize this? What the health team does is in every campaign where small fund is released, we always look for a way to reach a very few of these settlements that are close by. Okay, so that's an interesting, but that's what you've done in the past. You need to say, based on this situation analysis, do you see anything else that you could do? And yes, okay, so this is missing the ID number from the Ideas Engine. That's very important, so we can give credit to the author, but good that this person has cited an example. Now, this looks like somebody uploaded a summary report of a focus group discussion, so this is obviously off topic and is immediately disqualified from the exercise. This one, OPV non-compliance despite all mobilization. So this is from Nigeria. This is a person who works with WHO. Here we're missing the actual KFA number. We have an index number that we need that. So please don't forget when you look at the list to copy the whole thing. So challenge is vaccine hesitancy or non-compliance with oral polio vaccine by some community despite all social mobilization. And okay, so that's an interesting one. Why do some caregivers refuse OPV in spite of all the health talk and demand creation? All right, the cover note seems like a good start. There's some information, local specific information about who's who. Obviously, this is not complete. Second, the situation. So, all right, I like this. This looks like trying to do root cause analysis. So is it due to their religious background and belief? If it is, then why? Why? And you keep asking why, you need to ask why at least 5 times. Let's keep going. Data sources, community survey questionnaire to retrieve information. So when is this something that's already happened? If so, where is the report? Can you cite it? Can you refer to it somehow? Data sources are the caregivers direct. How are you involved in this? Tell us. We need to bring it to life for us so we understand. Now, key findings. All right. Also, some feel that they felt needed is not granted. Yeah, sure. So there's some interesting specific information here about what the person found or thinks about the situation. And then here are the next steps. Okay, there's some very specific next steps. This is almost like an action plan. I'm going to take these specific actions. Holding a compound meeting, get a religious scholar or focal person, provide health talk, hold sensitization meetings, hold capacity building. Okay, so I go back. If the problem is, I don't see what is specific about OPV in these steps, and I wonder, have these been done before? If they have, then how is doing them again going to produce a different result? And I do appreciate that there's at least one here. Okay, use of community mobilizers, one idea from the ideas engine. The purpose of citing those ideas is that you can find sort of next steps that are original that you haven't done before in response to that. All right, so lack of finances and inadequate training hampers immunization activities. Sure, fair enough. This is from Kenya. Inadequate supplies of vaccine. Okay, and inadequate knowledge. All right, so I don't understand if this is about supply. How does knowledge factor in? There's probably a relationship, but it's for you to figure out what the right question is. How is lack of knowledge by immunization staff hampering or causing problems for supply issues? Is it that they're not trained to handle vaccines in a specific way? That's what it sounds like to me, but I cannot know because I don't, so far I'm not getting the information I need to understand what situation exactly is being analyzed. I guess this is just a note for now. So please, the cover note needs to be really written. It's a message you're sending to your boss. So you know how you talk to your boss. You know how you write a message to them when you have something that you want to bring to their attention. My situation, all right, there's no need to say hello. This is not a, but we don't formalize about the format and things like this. One of the challenges is my facility is lack of finances, missed opportunities. Yeah, sure. Okay, so this sounds like a purely financial resource problem. Information keeps changing and staff needs to be updated. Okay, is there a relationship between the two? Otherwise, you need to pick one. I mean, that could be, you can work on two problems, I guess, but sounds to me like the steps you would need to take to address supply issues would be very different from the ones you would take to address constant job rotation, people changing all the time, and so on. All right, immunization registers and vaccine ledger books. There I question, first of all, do you have these? What do you do with these? How do you work with them? And so on. And then how is each one actually helping you answer your question? I'm not sure. So tell me. Key findings, missed opportunities realized from inadequate supplies. Yes, so you told us that in the situation, the idea is to go deeper. That's why we talk about situation analysis. You know your situation, but why are there inadequate supplies? Get to the root to the problem by asking why 5 times. Now, my step is to overcome the challenge, advocate for allocation of funds, advocate for organized trainings. Okay, the problem with both of those is, if there's no money, there's no money. And if there's no money, there's no way to cover the costs of additional training. So I would look at other kinds of solutions, such as those in the ideas engine. Now, appreciate that this author went and found something on health financing in the ideas engine. Tell us how you used what you found in the ideas engine. And then here, the next steps is really, okay, you want to overcome the challenge, advocate for the allocation of funds. How? All right. You want to organize trainings. What do you want to train people on? Where are the gaps that you see? So these are some of the questions that come up with this one. So I've been speaking really fast. This is a quick overview of some of the first situation analyses that come in. I think some people were just testing to see if they could upload something. Please do not upload something off topic. That is not what we asked for. We understand if it's incomplete, it's better to submit something and stay in the running so you can participate in peer review and participate in the exercise than to submit nothing. But please respect your peers, respect your fellow members of the movement, and take the time to get this right.